Welcome back. The COVID-19 pandemic has exposed the critical importance of the healthcare industry. This global crisis has particularly shed light on the often overlooked yet indispensable contributions of home healthcare workers. Home healthcare workers play a vital role in extending crucial care to the most vulnerable segments of society, including the elderly, adults, and children with disabilities. Often placing their own health and well being at risk, they offer indispensable support and assistance in the face of adversity. Joining us now is the founder of Anchor Group, Kevin Howell, and the executive director of JASA Care Home Care Services, Svetlana Goykhberg. Thank you so much for joining me today.
Thanks for having us.
Thank you.
So just to start off, can you just tell me a little bit about the kind of work that Anchor Group does?
Okay, so the Anchor Group is a strategic consulting firm. We focus on building workforce solution technology, but also helping organizations with optimizing their processes, as it were, to improve care outcome at the end of the day.
And Svetlana, there is a disconnect with how home healthcare workers are seen in the healthcare industry. Can you talk a little bit about that and how you're working to change this perception?
Yes, traditionally, home care workers were seen as someone who cleans and cooks and maybe does a little shopping. So, as COVID showed us that home care workers are playing an essential role. They are our eyes and ears out there. When people are home, the only person, except for family, that visit here and there, they are actually the ones who letting us know what's going on in the house, what's the progress health-wise on our clients, and letting us know if there are any problems, anything that we can assist this client to stay home healthy and happy. It's all about.
Personally, on one end, they're helping with the changing conditions and notifying us of that, but they're also integral in connecting those clients to care in community. So they're the ones who are following the clients to their appointments, and they're the ones who are essentially ensuring that the client is adhering to their medications. And so they're integral, though they're not providing clinical services, but they're providing the support.
Absolutely. And you both are very passionate about how post-acute care really isn't taken seriously. So with that, can you explain a little bit about your work and how you're willing to bring more awareness to post-acute care?
So the question is, what is post-acute care, right?
Mm-hmm.
So when somebody leaves the hospital from an incident, whether it be an emergency surgery or just a condition got exacerbated, they come back home. But during that period, oftentimes they're not fully recovered.
Right.
So in that period, you want to be able to connect those persons to other services. So whether it be therapy, or it be nutrition services, or it be connecting them with their PCP. Mm-hmm. So post-acute care is what ensures that that person don't get readmitted in the hospitals, right? And home care agencies like JASA Care is doing a lot of work in that area.
We are doing a lot of work in that area in terms of educating our aides so they can really assist our client to prevent being rehospitalized. Right. These three to 6 weeks post-hospitalization, whether it was a acute treatment condition or someone had a procedure, is really important to watch for certain signs and symptoms, making sure, as Kevin mentioned, that the client follows their medical appointments with their primary physicians, with their specialists, and they're taking medications and they're taking them properly as instructed by the hospital personnel. And the only person that's there is the aide. So once we educate the aide, they would alert us if there are any changes or something goes wrong, so we can really get in and intervene and make sure that client is on the right path.
And what's interesting too, just to kind of add to it, the aides are not alone. Mm-hmm. Because home care agencies, traditional LICSs, have nurses who are going out to do these post-assessment, those post-hospitalization assessment, and are training the aide and are training the case coordinators to ensure that the treatment pathway or plan is essentially followed. So it's not just the aide alone all up by themselves. They're guided and they're supervised by our registered nurse.
Right, but I think traditionally for many years, even though the registered nurse was always there, the aides were not given a proper support the way we're giving them as a industry, understanding how important they are, and that communication between the clinical team and the aide and the client, of course. We also at JASA partnered with a provider called VestaCare. They're providing telehealth, care management, and remote monitoring while the client is home, overseen by a group of clinicians. So if there is any deviation from normal, of course, our aide will get support from that clinical team as well as JASA's clinical team to make sure that they know what needs to be done and the client is stable.
Yeah, that's great that you mentioned that, and specifically with the support, because it does take a village at the end of the day. And speaking of support, coming up in August, you have your inaugural CARESTAR Awards event. Can you tell me a little bit about that event and what you hope to accomplish from it?
Okay, so the CARESTAR Awards is this year we are identifying home care workers. So it's a year of the home care workers. And we conceptualized this event in 2019, but then COVID happened. And so this year, there are three main goals towards the event. One is to provide a stronger light on the work that the home care workers are doing. Two is to provide information about the types of services that are available to people who need home care and might not even know how to connect with home care. And three, it is also to attract workers to the industry. There is a shortage of home care workers healthcare workers. You see the issue with nurses and similar to with home care workers, population is growing, age population is growing. And so we want to be a part of the conversation to say, hey, this is a profession that you can start in, because it's not a destination. And for many people, it might be a destination, but for many young people who are in high school, leaving high school or in two-year colleges, home care is a great option to really build your people skill, build your skill with understanding, kind of providing services, social services, and connecting people to clinical services. So changing the lens, changing the conversation is not housekeeping.
Right.
It's actual intricate work that these home care workers are doing to keep people in their homes and in their homes safely aging in place.
And with that, can you tell me what went into selecting some of this year's honorees?
So we partner with several of the agencies. So we have a bunch of agencies that are part of the process: CABS Health Network, JASA Care, SCS, Sunnyside, Home Care Services. And we selected aides. They selected their best aides, essentially. And then we've screened the aides. And we have judges now who are determining the kind of the bigger awards. But I mean, for the most part, this year, we're really trying to recognize as much of the home care workers as possible. The event is on August 3rd. At Terrace on the Park in Queens. And so we're really, really excited about the first year of the event and just all of the participation and support that our partners have been giving and just driving, not just saying that we want to support home care workers, but we're doing it.
We are actually doing it, and I wish I can recognize each one of them out there. They all do a great job. Unfortunately, it's impossible, but I'm hoping that this event will take place every year so we can recognize more and more employees, our home care workers that are doing such an incredible job. And I think the timing is absolutely right because of COVID and what our aide been through. And I never stopped serving our clients, whether the subway was running or the buses and the whole chaos that was out there, making sure they make it in and assist this vulnerable population. This is a great time to recognize their hard work.
Absolutely. And with that, I want to thank you both for taking the time to speak with us today.
Thank you very much for having us.
Thank you for
really
having
appreciate
us.
it.
For more information, you can visit their website at anchorgroupcorp.com and follow them on social media at Anchor Group Corp. Don't go anywhere. We'll be back with more Open right after this.